Today, we are going to talk about the 8 warning signs that tell you are going to have an issue with brain tumors. What is a brain tumor? How is it diagnosed, and is it treatable? Stay till the end to learn about this important topic. What is a brain tumor? Before we go into the symptoms of brain tumors, let us first talk about what exactly a brain tumor is. Simply put, a tumor is an abnormal growth of cells, and a brain tumor is an abnormal growth of cells in the brain. But things get a bit more complicated. Our brains are, after all, complicated and somewhat mysterious organs. There are different parts of the brain, and these parts are responsible for performing different functions. The cerebellum, for example, is responsible for posture and balance. Brain tumors can occur in any region of the brain. In addition, it may occur in the brain stem, the skull, or the sinus. When there is an abnormal growth of cells in our brain, often the other parts of our brain get squished. They can also block the flow of blood and other bodily fluids. And this leads to a buildup of pressure. The tumors can also spread from one part to another. In some cases, these tumors can be cancerous or can turn cancerous at some point in the future. Sometimes tumors spread from the brain to the rest of the body through the cerebral spinal fluid. The likelihood of getting a brain tumor is pretty low. However, it is a serious condition that can often be life-threatening. Now, let us look at some of the signs you may have a brain tumor. The first symptom is usually cognitive changes. People who have developed brain tumors have reported developing memory loss or having difficulty focusing on tasks. For example, in a situation where a tumor is developing on the left side of your brain, it is possible that you may face memory loss in relation to images, smells, and names. The second symptom we will discuss is changes in a person's personality. Brain tumors are associated with increases in mood swings, anxiety, and indecisiveness. These changes in personality could be caused by other natural factors like stress. But in some cases, it could indicate that a tumor may be developing in the frontal lobe of the brain. The third symptom associated with brain tumors is constant tiredness. Researchers have identified that one of the early signs of the development of a tumor is fatigue, even after a good night's sleep. Next, we will look at the fourth symptom, which is nausea and vomiting. As we discussed earlier, brain tumors cause an increase in pressure in the brain. Now, this can result in the feelings of nausea or vertigo that just don't go away. Now, you may dismiss headaches as a common condition that is caused by stress or overexertion, but headaches can also be caused by the growth of tumors in the brain. You should be concerned if you get a headache that starts when you wake up and keeps getting worse as the day progresses. The sixth symptom we will talk about is weakness and tingling sensations. Brain tumors can affect our nervous system in many ways. Some of the manifestations are feelings of weakness and tingling. Another symptom of a brain tumor is the development of vision problems. Tumors have been known to affect the optical nerve, causing issues like blurred vision, extreme light sensitivity, or even loss of vision. The eighth symptom of a brain tumor is seizures. The development of tumors in our brain disrupts the nervous system and causes seizures. Research tells us that symptoms like drooping, gait issues, slurred speech, and sudden loss of appetite are also associated with brain tumors. Now, it is possible for a person to develop a brain tumor yet display no symptoms at all. If we look at meningioma, which is one of the most common tumors to affect adults, the tumor grows slowly, displaying no real symptoms, and only when it becomes large does one suddenly feel the onset of the tumor. In addition, it is not always the case that a brain tumor will develop in the brain. Metastatic brain tumors are tumors that grow in other parts of the body, like the lungs, skin, kidneys, etc., and they spread to the brain through blood or other bodily fluids. Now, let us consider what is the difference between a brain tumor and brain cancer. So cancers and tumors are caused by an abnormal growth of cells. However, all brain tumors don't cause cancer. But brain cancers are caused by tumors, so brain cancers are a subset of brain tumors. A non-cancerous brain tumor is referred to as a benign brain tumor, and a cancerous brain tumor is called a malignant brain tumor. Let us now look at what exactly a benign brain tumor is. A common example of a benign brain tumor is meningioma. Meningioma usually affects adults. It is a slow-growing brain tumor that damages parts of the brain gradually. It can become life-threatening all of a sudden. If we look at malignant brain tumors, we can consider olfactory neuroblastoma, which is a form of malignant brain tumor. Malignant brain tumors tend to grow rapidly, and it is often the case that they are life-threatening. Previously, we had discussed about how some tumors originate in the brain, whereas others develop in some other part of the body and then spread to the brain. So now, let us look at what a primary brain tumor is. A primary brain tumor often starts in the brain. An example of a primary brain tumor is meningioma. On the other hand, a metastatic brain tumor develops elsewhere in the body. In contrast, a metastatic brain tumor is a kind of tumor that metastasizes elsewhere and then goes on to spread to the brain. So an example would be when breast cancer spreads to the brain. So in this case, it would be called metastatic breast cancer and not brain cancer. Metastatic tumors are the most common form of tumors that affect the brain, and they tend to grow rapidly. It is often the case that people affected by lung cancer or melanoma tend to develop metastatic cancers. Next, let us discuss where a brain tumor may be formed. There are specific regions of the brain associated with certain tumors. So, a meningioma would be formed in the protective membranes of the brain called the meninges. Skull-based tumors are often seen towards the base of the skull, whereas the cerebellum or brainstem is associated with tumors like medulloblastoma. Gliomas tend to occur in the glial cells. Now that we have discussed the symptoms of brain tumors and the types of brain tumors, let's look at how a brain tumor is diagnosed. The symptoms of brain tumors like headaches or mood swings can have many causes. So, in such cases, one cannot tell for certain that a person has a brain tumor. It is necessary for a thorough neurological examination to be carried out. This examination would include things like an assessment of a patient's mental state, a determination of whether there is any memory loss, and a test to see if there is any degradation of their reflexes. The tests are preliminary and help the doctor gain an insight into the neurological condition of the person. Then, to affirmatively diagnose a person, it becomes necessary to conduct imaging of the person's brain. Usually, this is done by way of a CT scan or an MRI scan. In case the imaging reveals the presence of tumors, the doctor may direct that a biopsy be conducted. During a biopsy, a small amount of the tissue would be collected and analyzed. In some cases, a spinal tap may be necessary to examine the cerebrospinal fluid. Now we will discuss the causes of brain tumors. So, among some people, their risk of developing tumors is high due to genetic predisposition and hereditary factors. However, this genetic predisposition accounts for only 5% of all brain tumors. In other cases, it is due to the presence of cancer elsewhere in the body, and cancer metastasizes and spreads to the brain. In rare cases, brain tumors occur in people who have been exposed to some radiation. There are cases where doctors have been unable to identify a reason behind the development of brain tumors. The next topic that we will discuss is how a brain tumor is usually treated. In most cases, surgery is the only option. In some cases, the tumor can be removed with little or no damage to the brain, whereas in other cases, these tumors are located in such spots that they are not accessible to a surgeon. However, these surgical procedures are risky, and they could lead to severe paralysis or even death. In addition, brain surgery is a delicate procedure, and it could result in paralysis of the patient or a reduction in the mental abilities of the patient. It is possible that the surgery is unable to remove all the traces of cancerous growth from your body. However, it can reduce the pressure buildup inside your skull due to the growth of the tumor. Treatments like radiation therapy and chemotherapy may also be used. We discussed earlier that seizures were a sign of brain tumors. On a final note, let us look at how you can help someone who is having seizures. The first thing you should do is be with them during the course of the seizure. Then, loosen any tight clothing and anything around their neck that may constrict their breathing. You should then check if they are breathing. Then call for help. In case there are convulsions, try to place a soft object like a pillow or folded towels beneath their head so that they don't whack their head against the floor. It is a bad idea to put anything in their mouths during this time. No matter what you see in movies, this is a terrible time to introduce anything into their mouth. So, there you have it. We have discussed the 8 warning signs that tell that you are going to have an issue with brain tumors. We have also discussed some important things to keep in mind about brain tumors. Always remember to consult your doctor in case of any issue you face. How is your health doing? How do you feel? Let us know your thoughts in the comments.